give us a sense of how much we should pay attention to the testimonies of a couple of doctors that have really cut through, those doctors in South Africa talking about how cases of Omicron have presented and the symptoms that they've presented with. How much weight should we attach to those testimonies, given the youth of the South African population and the way that the COVID variants we know very well about, they affect older people? What is your assessment of that new information?
Yeah, good morning, Anna. Yeah, I think what we certainly were seeing in South Africa, and this is obviously preliminary information, pre-observations, is that the cases appear to be so far mild cases. There are two things. One of them, that they are mild cases, and secondly, there have been a significantly large number of breakthroughs. Individuals who've been fully vaccinated and are still being infected. But fortunately, as I mentioned, those breakthroughs tend to be mild. It is early days. We still are observing what's the transmissibility of the virus, and also how is it expressed? How, are the cases more severe or not?
Yes, indeed. And so we want to get more information. And as you say, we'll probably have to wait for that. But in terms of the breakthroughs and whether the vaccines hold up, I mean, is there a sense that this is worse than Delta? Because, we have plenty of anecdotal evidence and other data to suggest that there are breakthrough infections of the Delta variant also. I mean, you might end up with very mild symptoms as a result, but it happens. So do we have any information on whether that breakthrough is more severe with Omicron?
We can look at it at various levels. Certainly, if you look at the actual mutations themselves, those mutations, and we look at other variants, are mutations which do govern transmissibility or infectiousness. That's just simply looking at the sequence of the virus. There are laboratory tests which are underway at the moment in 2 laboratories in South Africa, using both a live virus as well as a artificially made virus, a pseudovirus, to see if people that have been vaccinated, if their antibodies that they make do neutralize this particular Omicron variant effectively. Now, obviously, these tests they're not overnight tests, obviously, and we'll have to wait for about a week or maybe 2 weeks to get that information. And then at the third level, of course, is just observing individuals. Now, what we do from the observations, and of course, I must stress, these are preliminary observations, there do appear to be a significant number of individuals who've been fully vaccinated who are being infected.
Professor Jennifer Rowan, I want to bring you into this. Obviously, we're lacking a lot of information here at the moment, but based on the news you've received over the weekend, what's your main takeaway? How nervous are you that this will be worse than Delta or not?
Good morning. I think it's a little bit concerning looking at the mutations, as Professor Schoub has already said. It's got 32 mutations in the spike gene. This is the key that allows the virus into the cell. We know about some of these, and we know they're concerning mutations, but the kind of scary thing is that there's 26 mutations that we've never seen before in sort of areas of concern in that spike protein. So it is possible that this will have a constellation of mutations that could be more concerning than previous variants of concern that we've seen. But as the professor has noted, it's just too soon to tell, and we still need to do these lab tests, which will take a couple of weeks, and then the real-world data, which will take even longer. So it's just a watch-and-wait scenario at the moment.
I know we can't say much with anything concrete at the moment because we're still waiting information, but obviously most of us are completely in the dark and blind, and we're looking for some guidance of probabilities. And one of the ideas, obviously, that everyone's hoping at the moment is that it might be more transmissible, but maybe less dangerous. How probable is that? Is that a completely tail risk and way too hopeful outcome, or is it something realistically to consider?
Well, these viruses. I'm sorry, who's answering the question here? Go ahead, Professor.
So I was going to ask you that, Jennifer. Apologies.
Yeah, basically, this family of viruses, we know it very well. It causes the common cold. So it's well within its repertoire to cause a less serious disease genetically and from what we've seen in the past. So it is conceivable that this virus might be less virulent. This is possible. And of course, if it's more transmissible and less virulent, that would be a nice scenario to be in because it will sweep around the world, but possibly not cause so much havoc. So it's really too soon to tell, but that scenario is possible.
OK, well, at least it gives us hope, Jennifer, that you're not ruling that out entirely. And Jennifer, I'll stick with you. And I just wanted to get your perspective, for sort of public health perspective, on the travel bans that we're seeing introduced. I don't think any world leaders or public health authorities introduce these travel bans really thinking that they'll be 100% effective and they'll totally keep out a new virus strain. And we know that it's in Europe already, for example. But maybe they introduce it because they want to slow the spread of this thing down. Taking the politics away, if that is at all possible, does that make sense to you as a policy?
Well, it's really hard to keep a virus out. Borders are porous. But having said that, the very late reaction we had with Delta certainly backfired. I think that's what governments are thinking about now. They waited too long for Delta, and they just decided to go straight in with the travel bans. I think it's more important to track down the people who have this variant, and you can do that because they show up on the test a little bit different than other variants as a dropout. So you can see it, you can track it, you can trace it. So if you follow the people and you perform really good public health measures, we might be able to keep the clusters under control. Having said that, if it's very transmissible, that will be very difficult.
Barry, I wanted to get your kind of viewpoint on in a similar kind of angle, that issue of the idea of closing borders versus internal restrictions. I live in Singapore, and I suspect the route here will be to not close the borders, but instead to restrict the internal movement. Which do you think is going to be proved most effective at the moment, and which should governments be pushing more aggressively?
Yeah, I've got a slightly different thing to the professor. I think that really closing borders, to me, doesn't make scientific sense. I don't think it's going to make really any difference whatsoever. Certainly won't make any difference to the introducing the virus. It already is there. It probably has been there for quite a while. It's only now being detected. So I think closing really is closing the door after the horses have bolted. That's the one aspect. I think slowing it down, again, I personally don't think that closing the border is going to slow it down because, as I say, it's already there. If it is highly transmissible, it is going to spread. I think what we do need to kind of recognize is that this measure is politically motivated, in my opinion. It is highly damaging. It's damaging to countries like South Africa, which depend on the tourist industry, and it's not really going to achieve anything from a public health point of view. So it is really a kind of nominal thing. I think certainly screening travelers coming into the country is critically important. Having them vaccinated before they come into the country is critically important. Closing the borders is not going to do very much except damage third world economies.
Barry, can I ask you about hospitalizations in South Africa? I've heard, and again, it's perhaps a little too early to know for sure, but I've heard that we haven't seen a tick up in hospitalizations with this new variant. But is that true, or how long are you going to be waiting to get confirmation that it doesn't present any major hospitalization risk, or the reverse? What's the time scale for that kind of information?
Yeah, we do have quite an extensive hospital surveillance system. It's called DATCOV, data on coronavirus. And that has, at the moment, there has not been any significant uptick. This is a slight uptick. But on the other hand, we are entering into our fourth wave. So we have to really kind of dissect out what's fourth wave expansion from the variant. And I think the bottom line, as it stands at the moment, is that we have not seen any significant uptick in hospital admissions.